That relentless head pressure means a sinus infection, but you're not sure where to go. That choice matters. Urgent care might be $150. The same symptoms at an ER could top $3,000. This isn't just about cost. Ignoring a severe infection, though rare, can lead to meningitis. You're not alone in this. Sinusitis causes 30 million doctor visits in the US annually. Next, you'll get a clear guide. When to treat at home, when to choose urgent care, and the signs you must go to the ER. First, understand urgent care's role. It's the middle ground for issues needing fast attention but aren't life-threatening. The surprising reality is that 90–98% of sinus infections are viral. They usually resolve in 7 to 10 days, and antibiotics do nothing. So, how can you tell if your infection is a simple virus or something serious that needs a doctor? Your first major clue is time. If your symptoms show no improvement after 10 days, it points away from a simple virus. A more definitive sign is double worsening. You feel better for a few days, then symptoms return with a vengeance. So you have 2 time-based rules. But what if it's day 5 and you feel terrible? Let's discuss symptom severity. Consider a fever. A persistent temperature over 101 or 102 degrees indicates your body is mounting a major defense. Now think about the pain. Severe, localized pain or swelling around your eyes or forehead means inflammation is extreme, and a sinus infection can cause a toothache. The roots of your upper teeth sit just below the sinuses, so pressure can cause referred pain. These indicators, high fever and severe or referred pain, are exactly what urgent care providers are trained to properly assess. Let's combine all of this. Here is your quick checklist for when you should go to urgent care. 1. Your symptoms last more than 10 days without any sign of getting better. 2. You get better, then suddenly get much worse. 3. You have a persistent high-grade fever. 4. You have severe facial pain or noticeable swelling around your eyes. And 5. You have a bad toothache or earache, but your teeth and ears have been cleared of any issues. But what about the symptom everyone focuses on? The color of your mucus. You're about to find out if green means you need antibiotics. This is a widespread myth. Mucus color comes from your own immune cells fighting an infection, which happens with viruses too. So, no. An urgent care doctor won't prescribe antibiotics based on color alone. They will look at time, fever, and pain severity. This distinction prevents antibiotic overuse. A good provider knows when antibiotics for a viral infection are not the answer. This might make you ask, if it's this complex, what exactly does an urgent care provider do to diagnose you? They begin with a physical exam. They will press on your sinuses, checking for tenderness, and look inside your nose, throat, and ears. Based on this exam and your history, they make a diagnosis. If it's bacterial, you get antibiotics. If viral, they'll suggest effective OTCs. Recall the $3,000 ER bill and the scary complications from the start? This is where it connects. Using our rules gets you an expert diagnosis at a low cost. We have established when urgent care is the right choice. But when is it the wrong choice? When do you need an ER? These are absolute red flags. Go to the ER for any change in vision, double vision, blurry vision, or swelling that forces an eye shut. Second, a severe headache combined with a stiff neck. This can be a sign the infection has spread beyond your sinuses. And third, any neurological changes. This includes confusion, difficulty speaking, or sudden personality shifts. Do not wait. Here is your complete guide. Mild symptoms under 10 days. Treat at home. Persistent, worsening, or severe symptoms. Go to urgent care. And for any of those critical red flags, vision changes, a stiff neck with a headache or confusion, go directly to the ER. Making healthcare choices can be confusing, but for sinus infections, urgent care is an affordable and effective option when used correctly. Share this with someone who is always dealing with sinus trouble. And for more straightforward health guides, subscribe.